What is otoplasty? So, otoplasty for prominent ears is a surgical procedure to reposition the ears that stick out excessively from the head. So, it reduces the ear prominence by reshaping or folding the cartilage, achieving a natural and symmetrical appearance. So, this procedure is common in both children and adults who feel self conscious about the prominence of their ears. So, what are prominent ears? The ears they stick out farther than 2 centimeter from the head. So, lack of the normal fold in the cartilage. So, there is no fold in the cartilage called the antihelical fold, and there is an enlarged or protruding conchal cartilage. The deep central part of the ear is enlarged. So, prominent ears are harmless but can affect the self-esteem, especially in children who may face teasing or bullying by the friends. So, who needs otoplasty? So, candidates for otoplasty can be either children, the age of 5 years or older, because at 5 years the ears are fully developed, so we can operate at the age of 5 years, who have the significant ear prominence and who are emotionally mature enough to cooperate during the recovery after the surgery. Second candidates are the adults. They are healthy individuals without serious medical conditions, the non-smokers, those who understand the realistic expectations of the outcome of the surgery. So the goals of the otoplasty, it reduces the angle between the ears and the head to a more natural position, and it create a fold, antihelical fold for a smoother contour, and reduce the size of the conchal cartilage, the pushback. The ear is pushed back towards the head by the permanent sutures, and we have to achieve symmetry in both the ears. So the procedure, the first is pre-surgical consultation. So the consultation, a plastic surgeon assesses the ear's shape, the size and the degree of the prominence to identify the structural issues, that is absence of the antihelical fold or the enlarged conchal cartilage. And during the procedure, the anesthesia, so it is always done under local anesthesia with some IV sedation. So patient is sleeping and we numb the local area. The surgical technique, so there are two methods. So one is antihelical fold creation. If the fold in the upper ear is underdeveloped or absent, we use some suturing techniques to reshape the cartilage. We can do suturing or scoring of the cartilage to achieve a natural curve. Second is the deep cartilage, that is conchal cartilage. The conchal cartilage is large, there is excess of the cartilage which can be trimmed, and after that we can push the ear back towards the head with again the permanent sutures. So these are called the setback sutures, which are placed behind the ear to secure the position closer to the head. So where is the incision or the cut? So incisions are made behind the ear. It is hidden behind the ear in the natural crease, so leaving minimally visible scar. So duration, it typically takes 1 hour, average 1 hour per ear. So recovery and the aftercare. So immediately after the surgery, the ears are bandaged with a protective dressing to hold their new position. So patient may experience the mild discomfort, swelling or bruising, which may be managed with the pain medication or sometimes cold compresses for around few days. So the first week the bandages are removed after 2 to 3 days and replaced with the soft headband to protect the ears. The patients are advised to wear the headband day and night for first week, and in second week the headband is worn only at the night. So what are benefits of the otoplasty? So first is the improved aesthetics. So you get a more balanced and symmetrical appearance. Your ears look natural and they are less noticeable. And second is the enhanced confidence and the self-esteem. So adults or the children, they feel more comfortable in the social situations, and the recovery is very quick. The complications are rare when it is performed by an experienced plastic surgeon. So what are the risks and the complication? Like any surgery, there might be some risk or complications involved, though they are very rare. So first is the swelling, redness, bruising. These are just for few days only. Then there can be numbness of the area. It is temporarily for few weeks only. The scarring, which is very minimal, it is behind the ear, but still scarring can be troublesome according to some skin conditions. And the most important is overcorrection or the undercorrection, the ears which are too close or they are still protruding from the head. So this is my experience. We always show our clients during the surgery with the mirror in the hand, and when they are satisfied we can measure that it is around 15 to 18 towards the head. So we try to achieve the symmetry and avoid such a complication. So next is the infection or the bleeding, the collection of the blood, the hematoma. These are rare, so we apply the pressure bandages for first 2 to 3 days to avoid such complications. And for infections, usually it is taken care with the antibiotics. Then the suture complications, the irritation of the skin, the extrusion of the cartilage, these are the extension of the infection. So what are the results? The results are immediate. So results are visible once your bandage is removed. After 2 to 3 days, you will be happy to see your new ear which are looking normal. And the long lasting results, the results are typically permanent as the cartilage is reshaped, and the results are very stable. So otoplasty for prominent ears is a straightforward and effective procedure, and it delivers the dramatic results which are aesthetically very pleasing, and the downtime is minimal. So it is especially impactful for the individuals who seek relief from the self-consciousness due to the prominent ears. Thank you.